When it began, I was out at a Team Canada tryout. I would feel these palpitations in my chest and I would feel like I couldn't breathe. I was having a heart attack. So I went to the emergency room and ruled that out. I didn't have the words to explain what I was feeling. I went to my coaches and tried to explain to them something was wrong. They, asked if it would help. I need to know if I made Team Canada. And it's certainly one of the most memorable moments of my life, but not for anything I want to remember, because the answer was no. And I left Team Canada that night and came back to Toronto. And within a couple of weeks, I was diagnosed with a severe anxiety disorder, severe panic disorder, clinical depression, agoraphobia, OCD. That was my sentence, and that's what I had to learn. Got to about the 5-year period after my diagnosis and realized that I was kind of going through the motions of existing. I realized I had a choice to make. I could give up, I could accept there was no point, or I could work and find out what the point could be and whether or not there was some other life for me living with mental illness. I realized that there wasn't going to be this pill that would make it go away for me. But what there was a better medication that enabled me to kind of eliminate the extremes. When the severe depression was gone and the severe anxiety was gone, I existed in this place where I could start to learn more. My psychologist had also suggested I get into yoga. I'm a hockey player, we don't do yoga, but at that point I was willing to try anything. I started to learn more about the deep breathing and relaxation, meditation and mindfulness. And those skills helped me to cope with my mental illness so much better. 10 years total, and another 5 years after realizing I needed to change, I got to a point where I think I really achieved recovery. The most important thing to me after achieving that place of recovery was realizing that I felt awesome and nobody knew about it. I had spent 10 years describing myself as pathetic and being ashamed. I remember and thinking, I'm part of the problem. So I went out and I started sharing my story, and I started in schools, smaller groups, and I started to kind of understand the feedback I was getting and the response I was getting, and the understanding of how important it is that just that shared experience, that lived experience of knowing that you're not alone. I didn't want anybody else to think that they were alone anymore. We've got the conversations happening now. We've got these platforms that exist where people are starting to feel more comfortable having this conversation. But more importantly, I think, is the action to actually create a response to what's happening. It's still such a huge, confusing, complex infrastructure that's lacking in all these places. And there's just not enough help there for the people who need it. Ultimately, there's going to have to be a national solution. Those facilities are going to have to be created. They just don't exist yet. This doesn't come from the top down. It's going to continue to be all of these islands that exist in the mental health system, and those islands are so impossible to navigate. Until we get that sorted out and bridge all those gaps, we're not going to have a positive response, and we're not going to have a healthy response.